Hi, my name's Phil. I like talking about politics. In this video, I'd like to discuss the conclusion from MPs on the Public Accounts Committee, which is a group of cross-party MPs, which includes a majority of Conservative MPs who have said that the government threw care homes to the wolves during the coronavirus emergency. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, this part of the report concerns the quite horrendous policy of moving elderly patients from hospitals into care homes without ensuring that they were not infected with COVID first. Not only was it common sense during a serious viral epidemic to ensure that the most vulnerable would be shielded, but the government's stated position was that they threw a protective ring around care homes. That was their turn. 20,000 COVID deaths in care homes later, and of course the deaths of 500 healthcare staff, and there isn't a person in this country that should not be asking, what the bloody hell were they thinking? Because the answer is straightforward, of course. After 10 years of Conservative government undermining our health service, the NHS was going to melt. That was all there was to it. That was it. Boris Johnson needed to be able to tell the country at the end of this that the NHS stood up to the challenge. This was impossible, no matter how much money he threw at the problem. Not that much of that emergency funding ended up with the NHS. The report talks about the money that government threw in, but actually when you look at the total amount they have spent on the emergency on healthcare services, it's a small amount. But doesn't matter how much money you've got or how much money you're willing to use, you cannot conjure up a load of nurses and doctors overnight. We already had shortages in excess of 100,000 NHS staff, including tens of thousands of nurses and doctors. The Nightingale hospitals were set up as an emergency short-term bank of beds in order to cope with the overspill. And it all looks marvellous. It all looked, actually this is something that's going well here, but it was just a photo opportunity. Because although it did indeed mean having access to a load more beds, there were not the medical staff needed to operate them. You can't just shove COVID patients onto a bed in a warehouse and then leave them to it. The result was that hardly any of the beds were ever used because there was not enough staff. This was used as proof by the government that the NHS coped. After all, we didn't need the Nightingale hospitals, as if not using something was the same as not needing it. At this time, there were already hospitals warning that they'd reached their capacity. It was going to be a very telling scandal that would mean this government would never again be able to say that they'd looked after the NHS. Absolutely fatal with the electorate. So Boris Johnson needed a fiddle. We didn't actually have the spare capacity, so what to do? Can we create the spare capacity? We can make it look like we have done, but no, we can't. So the government's solution was to kick patients out of hospital as soon as humanly possible in order to keep freeing up beds. It was official government policy right up until the middle of April not to require a negative COVID test for anyone being discharged from hospital into a care home. Or anywhere else, come to that. But of course it was especially dangerous for care homes. Now, there were some elderly patients also going back to their own homes. They certainly should have had a test at least as well. But with care homes, of course, you've got a concentrated number of very vulnerable people. Now, the bottom line is that a hospital is absolutely going to be a major vector for the spread of COVID. It was one of the few places where lots of strangers would find themselves in one place. And of course, well, the one thing about hospitals is it attracts quite a lot of ill people. And of course, the lack of PPE meant that even basic attempts to contain the infection were impossible. Wash your hands a lot was the best that the Prime Minister could advise. Sing happy birthday twice whilst you do it. Unfortunate thing to say when dooming tens of thousands of people to never seeing another birthday again. The Public Accounts Committee, this group of MPs, has now published a report into their assessment of how we prepared the NHS and social care for COVID-19, which I'll link in the description below, of course. Now, the report notes some efforts to boost the NHS's capabilities, glossing over, I would say, quite a lot of the obvious shortfalls, but like I say, a clear majority of the committee are Conservative MPs, That's a compromise. And regardless of what they may think of Boris Johnson, they do not want their party being linked with a cock-up regarding the NHS. They've got to think about the next election under whichever is the next leader. But the report was scathing. Gloves off scathing, despite the Tory majority in terms of the attitude towards adult social care. Now, social care is a crisis that even Boris Johnson seemed happy to admit to last year. He was going to produce a plan to sort the whole thing out. That was one of his big promises last year. Now, I talked earlier this week about a proposal from the Treasury that would at least provide some extra funding for it. But from Johnson himself, we are still waiting for that plan that he promised us in 2019. Small wonder that it was still a mess in 2020's pandemic crisis. The report says in its summary, which is at the beginning, and I quote, "Years of inattention, funding cuts and delayed reforms have been compounded by the government's slow, inconsistent and, at times, negligent approach to giving the sector the support it needed during the pandemic." Now, they highlighted the decision to discharge 25,000 patients from hospitals directly into care homes without making sure that they weren't infected with COVID first. They noted that this remained the policy even when it became known that people could be infectious, pass the infection on, without symptoms. Not that that would be an excuse for me, because it's typical for people to be infectious without symptoms for viral conditions. That is the norm. There was no reason at all to suppose that this was not the case for COVID and should have been assumed until we knew different. Bloody ridiculous, medically illiterate even, to just suppose that you can only infect others when you yourself are displaying symptoms. We didn't even know clearly what the symptoms could be at the time anyway. We were still learning. The report also noted that they weren't just reporting on failures that occurred early on during the crisis, as if this is all went wrong, it shouldn't have gone wrong, it was absolutely disgraceful, thank God it's all sorted now though. No, still continuing. They said that PPE and testing provision needs to be urgently provided right now so that we can at least prepare better for future peaks, meaning that that's still not happening right now. There was also another telling comment at the end of the summary, which is, again, I say at the start of the report. It said, "No one would expect government to get every decision right first time round during such an emergency. Rather than seeking to give the impression that it has done so, the government urgently need to reflect, acknowledge its mistakes and learn from them as well from what has worked." Now that's a very conciliatory tone really, because at the end of the day, they didn't start acting until a long time after they had their warning. We were supposed to be preparing for this for years. We'd been warned about this for years. We'd been warned about this specific outbreak months before we did anything at all. But still, you know, the conciliatory tone, which may not have actually been anything to do with the fact that majority of the committee are, as I say, Conservative MPs. Because if you think about it, I mean, Boris Johnson is a fairly vain and egotistical man. So if you simply tell him that he's a callous blockhead, I'll do no good at all. You know, unless you can do so from a position of great strength. But Boris Johnson has all the power. So this was, I suppose, the carrot of letting him know that it would not hurt his reputation to admit to errors as long as he reflected on them and put them right. And for your commoner garden egomaniac, it might actually work. Unfortunately, I think it's very unlikely to work with this government. Now, in explaining that, I will present to you Exhibit A, which is Dominic Cummings's Durham trip. Now, think back to how the government responded in order to avoid sacking Cummings. Boris Johnson wasn't going to countenance having Dominic Cummings sacked. So he had to defend him. Now, what they should have done was just to have said that, do you know what, in the heat of the moment, he made a poor decision, you know, played the caring family man card, which they tried to anyway, and just said, he messed up, yeah, he messed it up, he's very sorry about it, wasn't thinking straight, just concerned for his family. He's apologised. Now, there would still have been pressure to get rid of Cummings because he's not liked, either inside or outside the Conservative Party. but it would have been less pressure than existed with what they actually did, which was to deny any wrongdoing at all when it was fairly obvious that wrongdoing had occurred. Even going as far as getting Michael Gove to say in a television interview that he's sometimes gone for a drive to test his eyesight, as if it's a perfectly normal thing to do. The mindset of these people is simply one of never admitting mistakes. They see it as a weakness, not a strength. Now, I've been a teacher for over 20 years. You see the same sort of thing even in bright students. You know, the students who will achieve what they should are the ones who are constantly asking questions, constantly seeking to clarify that what they've done is correct. And when they haven't got something right, they want to know where. You know, you can give a test to these people back and they've got 95%, and they'll come to you and want in detail to know how they dropped the 5%. Then you've got the other ones, might be perfectly bright, but they never ask questions because they think it makes them look stupid. And when you give them a test back and you go through it with them, they're quite reluctant, and they certainly do not want you to explain in detail exactly how they dropped the marks because they think of it as a weakness. So I don't think that this appeal will work on Johnson ultimately. The best we can probably hope for is that they privately acknowledge the errors and put them right before the next peak. And I'm sure it'll come as no surprise to people watching that I do not believe that he will put enough things right to do better in the second wave, but there is a chance he'll put some things right at least. That is probably about as much as we can hope for right now. But there it is. Hope you found the video interesting. If you did, don't forget to click the like button. If you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.